Welcome to Heart Nurses, brought to you by the Preventive Cardiovascular Nurses Association. PCNA's mission is to promote nurses as leaders in cardiovascular disease prevention and management.
I'd like to welcome our audience today, where we have two exceptional professionals at the table. I'm going to go ahead and let them introduce themselves to you.
All right, so I'm Cheri Nichols. I live in Colorado, and my career was based in the community. I was a health counselor, a screener, a supervisor of other nurses, and that was an extremely rewarding career that I had for about 20 years. And prior to that, I was on the psych unit in the hospital, taking care of adults that were in crisis. So those are my two aspects of my background, and I'm thrilled to be here to talk about the art of nursing.
Excellent. Jody, how about you?
Hi, I'm Jody Hereford, and like Cheri, background in clearly nursing. That's why we're here at PCNA, and I also have my master's in exercise physiology, and I found my passion really in health coaching and motivational interviewing, where we really have the opportunity to have artful conversations with our people who are looking at better health.
Excellent. Well, I'm sure our audience can tell that we're going to be changing gears just a little bit compared to some of our previous episodes, where we've been talking about a lot of the science behind nursing. What do the guidelines say? What's the latest treatment option? But it's very important to be well-rounded, and this team at this table today is really going to focus on the art of nursing, because it is art as well as science, as we all know. Sometimes it's not quite the things that you can find specificity about when in any journal article, but it's equally, if not more, important. Mm-hmm. So, Cheri, could you tell us just a little bit about what it means to you to have the art of nursing?
I really want the people that are listening today, and I think that anybody who's tuning in is tuning in because they're interested in thinking about this as an art, thinking about nursing as an art, or maybe examining or exploring for themselves what their artistic contributions are in their work. And I'm hoping that anybody listening is going to think about and recognize their own artistry, because it's an ever-evolving opportunity, you might say, or journey. And so I wanted to start with some quotes, because once we decided on this topic, I did a little research and came across some quotes that I think will really evoke some of that just introspection. Florence Nightingale, to start with. She clearly saw nursing as an art, and the quote I found of hers is, "It is one of the fine arts." I had almost said the finest of fine arts. Yeah, my connotation of fine arts had to do with music or literature or visual arts, and I really wanted to see what might she have meant by that. And so the definition I found fits right in. It is an activity requiring great skill or accomplishment. And there are so many ways to look at that, right? And then another quote I came across was Rogers. "The art of nursing is the intentional, creative use of oneself based on skill and expertise to transmit emotion and meaning to others." So when I kind of pause at these words, I think they're the descriptors that help us to kind of maybe start to think of ourselves in new ways and recognize our own artfulness. I think that these quotes and looking at the art of nursing, I hope it's clear that it's not really about what you're doing in nursing, but how you're doing it. So it doesn't really matter what setting you're in. If you're in the ICU and you're talking to a family member, or you're talking to a colleague or a patient, wherever you are, or if you're in the ER, or if you're in the community doing a screening. It's a gift that you give your patients when you listen and when you connect and you show your compassion, because that's really the start of trust. And that's when the real work can begin if a patient wants to take action for their health.
Great point, Cheri, and I really loved the way you framed it up originally, Geraldine, of really looking at the art of nursing both being science-based and the art piece, and coming from a motivational interviewing perspective and really looking at the conversations we have with people, it matters. So in training coaches, I really talk with them about looking at both the art and the science, because there is science behind what we do, and certainly some technical skills that are so important to the healing journey. And I think often misunderstood and overlooked are really those relational skills. So when I talk with my students, I really talk a lot about transactional versus relational. And we've gotten really good in healthcare at really good technology, really good transactional pieces. And what we know is that that relational piece is a huge part of the healing journey. And one of the things that we say in motivational interviewing is really the fact that the way we are and the way we talk with people about their health substantially impacts their own motivation for change and taking an active role in their health and care. So I see that communication piece as just such an enormous part of our art and what we bring to the art of nursing.
I think what you both have described is more, it's even more than that. It's like the soul of nursing. That what sets nurses apart from most other professions is the empathy, is that relationship building, is that commitment to others as well as commitment to self, but really helping lift others up out of pain, out of poor health, out of a bad situation, be it acute care, and really is about embracing the whole person and seeing them as an entire thing as opposed to just a lab test or something that's in the electronic medical record. You have brought to mind an example from my own life where I was with my mother in a nursing situation. She was in the ICU, and I was so impressed by the nurse that took care of her on this particular day. The nurse said, we're going to take your mother from this stage to this stage in this day. And she was the one that provided me with hope. She was the one that provided me with the grace to know that it wasn't going to be an easy transition, but it was going to happen. And she provided me with the support I needed as a family member, because she said, I will be here the whole time and we will make sure that she gets from point A to point B. So that to me is really the art part of nursing.
Absolutely. She gave you, when you said hope and the words that you're using, I really want people to be thinking about how they are already providing these things for their patients without even maybe really thinking about themselves as an artist. But it's there. And when you were talking about the confidence that she gave you, knowing that she was going to be there for you all day with whatever was going on. And yeah, that's moving. Thanks for kind of gearing us up for talking more about that.
Well, I think to build on what you're saying there too is the fact that what you've just described isn't a 40-minute conversation. We have time to bring compassion and empathy and partnership and communication, and that is so instrumental in moving people through transitions, moving people through to better states of health. And it doesn't have to take a lot of time.
No, you do it with your eyes and your smile, and you're just really tuning in and paying attention. And people know when you're connecting with them, and when that's your your mission, and they feel it. And again, going back to, they'll remember how they felt.
So the quote that you're referring to is from Maya Angelou, and it's such a beautiful way of being. And it says, people won't remember what you said, they won't remember what you did, but people will always remember how you made them feel.
Mm-hmm. And you sure did. You sure remembered that, Geraldine.
And in the circles of motivational interviewing, we kind of separate that out from, again, transactional, relational, but it's really separated out from the doing skills. People think, well, it's about asking questions or affirmations, but more important and becoming even more important is the spirit and what we call the being skills. and that way of being with another that you so eloquently described earlier and you described, and that trust building and trust in a healing relationship is critical.
It's like the foundation, because once you've established that trust and that confidence and that hope, then if there's work to do, if there's change to happen, or if there's and the change might be just learning about and kind of committing in your mind to taking a new medication or to agreeing to a procedure. And as soon as we are comfortable with our provider, our nurse, who is trying to help us make that move, we are more receptive, we are more relaxed, and we can make better decisions.
Yeah, I was just going to say the other part of this that I think we talk a lot about, but we just neglect to think about the underpinnings of it, is shared decision making.
Yeah.
And if you think about all the decisions that you make every single day, the trust is a very important piece, the information is a very important piece, but knowing that you're heard is a very important piece as well. And so there's all these components of shared decision making that really require that art as well as the science part of being a nurse.
And putting the patient first. I mean, knowing, not putting the patient first, but making the patient the center. Allowing the patient, helping the patient be the center of the conversation. So it is shared. There's all kinds of things going on, that you're trying to work on, but the patient is the one who's going to take the action. And so giving the patient that, not just permission, but that encouragement and setting the stage for that, it's the foundation for everything that comes after that.
And there was a beautiful initiative that came out of the Institute for Healthcare Improvement a number of years ago. I believe it got started with the NHS in Great Britain, and it was a shift in question and really asking health professionals to be aware. And it was this shift from what's the matter with you to what matters to you, because only then, when we really understand where a person is coming from and what matters to them, are they able to hear and to move forward in their health journey. So I just love that shift.
Yeah.
That is amazing. I'm going to allow us to take a brief break, and we will be right back.
For more education, resources, and tools for your clinical practice, visit PCNA.net. You'll find CE courses, patient handouts, and more, all free to access. Visit PCNA.net.
And we're back talking about the art of nursing with Cheri and Jody. And hopefully the audience is just as inspired as I am about this very important aspect of nursing that there's really not training for, that there's really not a manual for, but there are some great resources to help you improve that aspect of you if that's something that you'd like to do. So Cheri, I know that you have some resources that you wanted to share with the audience. What might those be?
Well, I don't know if I would think of them as resources as much as just some food for thought.
Perfect.
And there was I came across a newsletter from 2017, the Vermont Nurse Connection newsletter. And Priscilla Smith Trudeau, she suggested that, if a nurse is listening and is thinking about, well, how do I start to maybe examine my own or explore my own potential for this artistry in my practice. And, I had mentioned that it isn't really about, what you're doing, but how you're doing it. And Priscilla Smith Trudeau suggested that you seek out nurses that inspire you. So if you've ever watched a nurse that kind of inspired you and you thought, how does she do that? Or how does that happen? How does she weave that into her practice? If you see a nurse doing something that inspires you, study their attributes and listen to their stories and ask yourself, well, why am I inspired by this? And start to think about, the way you do things and the way you would like to maybe kind of evolve in this way. It's important to develop your own style, but that doesn't happen overnight. It's something that we hopefully do every day throughout our entire careers. And she also suggested to seek out a mentor. And maybe that's one of the people that you observed that inspired you, somebody that hopefully exhibits excellent listening skills, knows how to give feedback effectively, displays empathetic and non-judgmental understanding, so that they're a living example of these values that we're talking about. So, obviously be willing to and really wanting to keep evolving in the creative and reflective process, because that's how we keep our practice fresh. That's how we keep moving in a direction where we're improving our skills and our style. And I think that that's a good place to start.
Yeah, and I love what you're talking about, because it really gets into what we in the coaching world call strength spotting, and really looking for what someone is doing well and affirming those things, whether it's our patient, whether it's a colleague, whether it's a mentor, and things that we observe. So often in healthcare, we look at deficits and we become deficit detectors of what's not working. And we all do so much better when someone catches us doing something right and calls us on it. And so that's what you're really describing here, is that strength spotting and what we in motivational interviewing call affirmation as well. And it's not saying, more empty, praiseworthy, like good job, nice going. It's really noticing a strength, a value, an effort. It was hard for you to get here, and yet you're here. You did it. And so it's just an amazing way to live. Our world is so much brighter when we start seeing the bright spots.
And it does, provide, or not provide, but instill that the beginnings of that foundation of trust. And it's within that trusting relationship that the work can be done. The harder work can be done. So
Makes the world a more joyous place, and makes work a more joyous place as well.
Right.
I know that you had some quotes that you wanted to share with our audience before we leave. Okay. And so I'm going to turn it back over to you.
Okay, Jody, do you have a quote?
I do. I have another Florence Nightingale.
Excellent.
You had inspired me. And it's just a beautiful quote from Florence from 1893 that says, "Health is not only to be well, but to use well every power we've been given."
Wonderful.
I just got like chills.
Flow.
Right. Okay. Oram, a nursing theorist, speaks of the art of nursing as being expressed by the individual nurse through her creativity and style in designing and providing nursing that is effective and satisfying. So often nurses are focused on outcomes, and we're focused on, the results. And we don't think very often about, well, how are we getting through our day? How are we feeling? Do we still have joy in our work? And I think that one of the ways that we can really do that and appreciate that, which helps us to avoid burnout and helps us to just want to go to work, want to have these conversations that can often be super tough, is to acknowledge, how good it feels when you're able to help somebody, to establish trust with somebody. Because you're not just doing that for them. You're doing that for yourself too, because that makes your work worthwhile. It makes it satisfying, enriching. So my final quote is by Piet Mondrian, and he said, "The position of the artist is humble. He's essentially a channel."
Well, we hope that you can take the information that you have listened to or watched today and channel it into your own life and make today and every other day in the future that much better. We are so grateful to our guests, Cheri and Jody, for talking about the art of nursing and the importance in everyone's life every single day. I'm your host, Geraldine Warfield, and we will see you next time.
Thank you for listening to Heart Nurses. We invite you to visit PCNA.net for clinical resources, continuing education, and much more.